What's up everybody, it's your girl D. Welcome back to my channel. If you're new here, I am the Big Apple Prepper, and today I want to be discussing first aid medical kits, and more specifically a medical kit that is lightweight, waterproof, and compact, but has everything you could possibly need to do some work in the field if it was necessary. Talk to you guys about where this idea even came from and just get down into the nitty-gritty. So my very first aid kit was when I went to go climb Mount Kilimanjaro. When you sign up to do the trip and make your payments and all that stuff, they will send you a list as to what kind of items you should bring to do the hike, especially if you're an experienced hiker. It's very helpful. So one of the things was a first aid kit, and I had never had a first aid kit before. I mean, yeah, I've had like Advil in the medicine cabinet, but I didn't have like a real first aid kit. So my very first aid kit, it was a tri-fold like roll-up bag. So it looked like one of those travel toiletries that you could hang up and all this stuff, and it was great. But after that trip, I realized that I could definitely expand on the items that I had in my medical kit. And one of the things that I thought was very important that a kit should have is the ability to be compact and waterproof. And with the roll-up kit, I just wasn't getting those things. When I would travel to other countries, this kit eventually, as it got bigger, it just got harder and harder to pack. So during my trip to Galapagos, Ecuador, I decided, like an idiot, to leave my first aid kit home. This is the trip that really opened my eyes as to how important it is to always have a first aid kit wherever you go, whether it's some of the things are done collapsing in my house. Back to my story. So I was in Galapagos, Ecuador, and I was going to do some scuba diving out there and check it out and all that stuff. And I just loved that trip. You just felt like you were in a scene of Jurassic Park because all the animals were like ginormous out there. Like, I'm talking about Charles Darwin and all that stuff with the big turtles. And they had seals like out on the dock and whatnot. So anyway, I'm very excited about this trip. So this rollout first aid kit I had, it just wasn't fitting in my bag, and I'm like, you know what, let me leave this bag behind, and I'll be fine without it. That was the worst mistake I ever made in my entire life, because when I went over there, I got food poisoning on the very first day that I was there. I was there by myself because I used to travel a lot by myself, and it was such a nightmare because in my first aid kit, I could have treated that very quickly. But in Ecuador, you cannot just walk into a pharmacy and buy some Pepto-Bismol or something to soothe your stomach. Instead, what they do is they have a treatment plan for loose stool, if you know what I mean. So you end up buying basically like this 1 week supply or 2 week supply or something like that of these tablets that are supposed to treat the diarrhea, and it's supposed to go away and stuff like that. And I'm like, I don't have that type of time. Like, I just want to take a simple Pepto-Bismol and have this go away. And it wasn't just that I was having that issue. I was also throwing up as well. Like, things were coming out of both ends. And I know this whole video is TMI. Anyway, after that trip, I decided I will never, ever go somewhere without my first aid kit. And this is currently the one that I keep in my bug out bag, but it is also medicine that I think to have in the house, just in case you also have to bug in. So my goal was to make this as super lightweight as possible, to also make it waterproof as possible, because another thing that I learned was that if your first aid kit is not waterproof, you'd be surprised how quick it could get wet, and your supplies will be useless if it rains, if your bag gets wet, if it gets drenched, if something spills inside. So I went ahead and I changed out that whole horrible toiletry rollout system that I bought for my Mount Kilimanjaro trip, and I got this thing instead. And not everything fits in here, but I'm going to show you how I organized my first aid kit and what I keep inside, to keep everything that I would possibly need as minimalistic as possible, that if I had to grab and go, that I could easily take my necessary medications with me. This bag does not include the usual medications that I take, so I am not going to be showing that because you guys don't need the medications that I take for my issues. But if you do have doctor prescribed medications, you should definitely keep that in mind as well to pack into your bag. So first of all, this bag is completely waterproof. It is by a company called Night Eye, and it is not intended to be a first aid kit, but rather I bought this silicone patch, and I put this tape, double stick tape that is super thick. I don't know if you could see the side of that, but it's not your regular Scotch tape that's double stick. It's a lot more heavy duty than that, so it should hold up. And I wanted, to show that it is a first aid kit in case somebody needed to go in my bag and grab my first aid kit for me. Part of when I was learning to scuba dive, as you level up, you're going to need different things in your diving kit as well. So as you go from like Discover Scuba to open water to advanced open water to rescue diver to dive master, you're going to need different things. And part of when you get to rescue diver, you're going to end up taking a CPR and first aid class. It's I believe it's necessary in the requirements that you need to pass. So I did end up taking those courses, and I learned a couple of things from taking those courses. Hopefully when and if I ever do get better, and if I ever end up scuba diving again, this bag would be completely waterproof that I could take with me. So I am super excited about that. And again, the waterproof bag, it has like a special type of zipper here that makes the seal waterproof. This channel is all about learning things through misadventures, and one of the things I learned when I brought my first aid kit with me when I went to China was this one girl that was on my tour bus. We ended up getting off the tour bus and she had to use the restroom. We all did. So we got out, and as she went to use the restroom and we went back to the bus, a spider bit her in the leg. And I'm like, oh my God, because you could tell it like started spreading and it was turning red and, getting bad. And she started to panic. And luckily I had one of those like itch wipes, and I think I had a Benadryl as well to give her. And as I reached into my first aid kit, I learned that my ointments had all splattered inside the first aid kit because of how that roll-up bag was working. So one of the things I do recommend is when you pack your bag, to keep the ointments separate into like a smaller container. So I keep all my ointments into a small Ziploc bag. That way, if that ever were to happen again, it would splatter just in the ointment section and not all over the pills section. In my ointment section, I have a Sunburn Rescue, and I have a few of these, and I also have my first aid alcohol wipes. I keep thermometers here, and you can place these on your forehead and they will light up and tell you what your temperature is, and they're reusable. So that's why I keep them there, because they are flat. So you can wipe and reuse. I also keep some BioFreeze. This is great for like aching muscles, and if you like pull a muscle or strain something, great to have in your first aid kit. I also keep an essential face wipe and some witch hazel wipes. These are great, also can treat a lot of different things. This would have been helpful to have when she had the spider bite. I could have gave her one. So yeah, this is what I keep in the ointment section of the baggie. Travel size Neosporin. So I also have these small wound seal capsule thingies that you can crack open and pour on a wound if the wound won't stop bleeding. And I also do have some liquid skin there that I got in Dollar Tree. So I like to keep these things just in case, you know, the wound just won't stop bleeding. The liquid skin thing I learned is very important to have in a first aid kit. I learned that on a trip when I went to Mexico, where people are reckless in other countries. And if you ever do decide to go scuba diving, I would highly recommend you just do it the right way. And what I mean by the right way is go to a school and get certified. Do not make your first scuba diving trip on a cruise. Do not make your first trip of scuba diving with some random hotel in some foreign country. You are asking for death, okay? And I sure as hell hope that you got travel insurance, because who the hell is going to fly your body back, okay? The reason why you do not want to scuba dive on a cruise is because no one is going to teach you the correct way to scuba dive. You're going to get a crash course in like maybe half an hour and then jump into the open ocean. And if you live, you live. Not very good. They're going to tell you it's safe, but I've heard a lot of horror stories. You don't want to make your first experience your worst one. So definitely do not do that as a first experience. The same thing with a hotel. They're going to give you a crash course in the hotel pool, and then they're going to take you out into open water. And, you know, if you die, you die. So again, who's going to fly the body back? You don't want to deal with that. You know, flying, if you die on a trip in a foreign country, it is not cheap to fly your body back. So really think about your family too, and always get travel insurance, even if it's the cheapest one, if you decide to do any extreme sport. Back to the liquid skin. I was in Mexico. I was going to do scuba diving, and a woman was going to do snorkeling. The boat was mixed with scuba divers and snorkelers. So the idiots that were running the tour started untying the boat as passengers were still climbing onto the boat. He starts untying the boat, and as passengers are still getting on, which is the most ridiculous thing. I was already on the boat, and so was my friend. So the boat started out like this. The boat's here, the dock is here, and the boat just starts going like this. As he's untying the boat, it like starts going like this. So when the boat came back this way, the woman stepped on, and then it went back this way really fast, and she ended up falling in between the dock and the boat. So the boat was going to come back and it was going to crush her. And I, you know, jumped into action because I am a certified rescue diver. I did train to save people. So I ran and I grabbed her hand, and one of the other boat crews people also grabbed her hand, and together we moved her away from danger and got her back on the boat. When she got back on the boat, she was completely scratched up, and after the shock was over, her losing her sunglasses in the ocean, which shouldn't have happened, she still decided to go snorkeling. So what the dive master decided to do was he put liquid bandages, liquid skin on her cuts, and she was able to go into the water without having bandages all over her, because this helps keep the bleeding in place. It's basically like a nail, it almost looks like a clear nail polish over the wound. So this is helpful to have if you have the space for it. It's better to have it in spray form, so you could use it on more than just yourself, but this one would be just for me. I could also use these on other people. These are not liquid bandages, but like I said, you can just rattle them on there. So That's what I keep in the ointment section of my first aid kit. The next thing I keep in my first aid kit is the basic medication. So I keep Dramamine, which obviously, for obvious reasons, I use when I go scuba diving. Before I was disabled, this was very helpful. Advil, because Advil helps reduce inflammation, whereas Tylenol just focuses on pain relief. Advil focuses on both pain and inflammation. So definitely there is a preference of ibuprofen to acetaminophen. Tongue-tied. Acetaminophen. Just pronounce that word. Do you know what I mean? So the main ingredient to Tylenol, I prefer ibuprofen. So I would rather get Advil if you have a choice. You obviously want to have Pepto-Bismol after I told you that story, because you can't get Pepto-Bismol all around the world if you're traveling. So you always want to bring lots and lots of Pepto-Bismol if you're traveling, and it's also good to have in your bug-out bag just in case. People used to die of diarrhea back in I think the 1800s and stuff. So I can't imagine dying of diarrhea but yeah, Pepto-Bismol. I also keep Rolaids because I get a lot of heartburn all the time, and these are pretty easy to use. They're chewable, so I definitely keep these. I have some smaller medications here where I keep sinus medication because I suffer from sinuses, and I also keep some Midol here for the ladies. Yes, you do want to have that in your bag in case your cramps get bad. I also keep some Dulcolax in here just in case you get constipated. You don't know how sick you can end up feeling, so I just took out a few pieces and have the individually wrapped ones. It's good to have in your bag just in case. Some things you may never ever end up using in your bag, but it's good to have them because if you need it, you need it. I also keep Bayer just in case there's someone who's having any heart issues. This is good to have in your bag. I have a tendency to pack my bag thinking about other people as well. So yeah, I will definitely keep Bayer in there. And I do keep Benadryl, like that story with the spider bite. And I like to have everything in travel sized so that I could use it up easier and rotate it out. So that is what I keep in my little pill bag, and we're gonna move on to the next section. In my next bag, I keep random things that you might need that you might have not thought you needed, but when you need it, you need it. So here I keep a Benadryl anti-itch stick. I like to keep different types of medication as well, because 2 is 1 and 1 is none. So if I have the other types of Benadryl and I have this stick, I could kind of rotate if I need to, depending on the need. I also like to keep some Ambisol in here because you can always put this on a napkin or a Q-tip and give it to someone that needs it or use it for yourself. I really think that dental pain is one of the biggest things that people forget about in their first aid kit. Especially in their travel aid kit, because if you get some kind of dental pain or crack a tooth or something happens and you're out on a trip or you're bugging out or whatever, it can really hinder you. You won't be able to move. You'll just want to rest. All you want to think about is seeing a doctor because it's right in your head. So it's definitely important that you carry some Ambisol gel so that at least you could remedy the pain until you can fix it. Speaking of teeth, this is a huge overlooked medical thing to not have in your first aid kit. And I have more crowns in my teeth than Queen Elizabeth. So very important that if one of those crowns fell out and the grid was down and I could not get to see a dentist to glue that crown back on, yeah, you can go out and buy Dentex. Is it called Dentex? It's Dentac at CVS, where it would temporarily glue your tooth back in, the crown of your tooth, and until you could see a dentist. But those things really don't ever last. They would only last until you eat something, and then it would keep falling out. So one thing that I do keep in my first aid kit is this kit to be able to glue your crown back on if the grid is down, and do it yourself. And I've read reviews before I purchased this, and I've saw that people were saying that your crown could last for up to a year. So you definitely, if you have any crowns in your mouth, you want to have this in your first aid kit, because like I said, the grid is down, something happens, you know, you want to be able to put a cap back on your tooth so that your tooth doesn't break. The next thing I keep is earplugs. Drops are good to have as well in your first aid kit. Vicks Vapor Rub in case you're having some type of sinus problem or chest congestion, or you're sick. This is great to have, and I have like the smallest version of it. Ammonia packets, because I am prone to fainting. I faint pretty often from my injuries, and if you would like to read about what happened to me, you can feel free to go to my page, click on the top right corner to the Buy Me a Coffee link, and there you can read my story. And if you're able and willing to donate, I would greatly appreciate it. It would help me get back on my feet. But I am super injured. I am doing the best I can in all of my videos to try to be as consistent as possible as posting videos for you guys, and to promote education, information, and raise questions and get a conversation going about preparedness. The next item would probably be shameful to anybody who promotes Jase Case on YouTube, because they're like, oh, this is great to have like super strong antibiotics in your travel system. But the thing is that when I travel, or if I'm bugging out, I definitely want to have something that is flat, because when I pack things, I focus on the flatness of them, and the pill bottles were just way too round and too much to fit in this bag. So I condensed them into these Mylar bags, and I still left this one in its box, but on the back I wrote what they're for, and these are different things that, this is the case basically that you would buy on Jase Medical. So if you're interested in that, I can link it down below in the description, and you don't have to keep it the way I do. I'm an embarrassment to the prepper community, but whatever. I like to have my stuff compact. However, if I was traveling overseas and I wanted to bring these medications with me, I would probably put them back in the bottles, because the bottles do have your name and your address and your information, just in case you get pulled over by customs. Like, you want to be able to explain that that's your medication. So definitely don't travel this way. But like I said, if I had to bug out within the state, or even in the next door state, like, this is something that is more compact for me to take. Do not, as I show, just take it for what it is. This is how I keep my stuff. You don't have to keep your stuff like this, but definitely worth picking up some Jase Medical antibiotics, because if the grid goes down and you're unable to get to a doctor, at least you have your stuff. And it also comes with this book that tells you how to use your antibiotics, so it's not a guessing game. And literally, this stuff would be a last resort if there is no doctor available, or if there was my Ecuador situation. This would have been super handy and would have helped me. The next thing that I keep in this bag is bandages. So I keep my bandages separated, because remember, going back to my China story, you do not want to have things splatter all over your bag, and if they do splatter, they're not affecting your bandages. And again, my bandages are in a waterproof container. Things you need to think about, you know, you go on a kayaking trip, water rafting trip, you gotta trek through the mud to make it to the other side of the creek. The more waterproof your bug out bag is, your suitcases, the better it is for you. Focus on waterproof. In my bandage section, I have this standard tiny little bandages and the regular size bandages, and I like to keep a lot of these regular sized bandages. I also have bigger bandages because you just don't know what you're gonna need. And this is something you would probably forget in your first aid kit. These are Glacier gel bandages and they work great on burns. However, I had burned myself pretty recently. And I used these for the first time. And my experience with them was that you have to keep changing them out every day until the burn heals. So you need to have a good amount of these guys, because having just one in your first aid kit isn't going to help you. If you have a really bad burn, your skin is going to be paper thin. And let's say you just have just the one band-aid just in case in your bag, right? What's going to happen is, let's say you really need it and you put it on and then it gets dirty and you need to take it off, or it got wet. Your skin is not going to be healed. It's going to be paper thin. Your burn is going to end up touching something and it's going to rip open, and it's not going to be able to heal properly. And then you're going to end up probably using one of these dressing bandages to cover it. And these bandages are going to get stuck inside your wound. Again, you're going to have to rip off the bandage. It's going to rip open your wound and it's going to be nasty mess. It's never going to heal. It's painful. So you definitely want to have a good stack of these burn bandages. They, I believe they also have some type of pain relief. I don't know if it's like lidocaine or something in there, but I do have them. I have different size burn bandages depending on how bad the burn is. So, those are my burn ideas with first aid. Moleskin, because if you're wearing some hiking boots or having to trek for days and days, you're going to want to have some moleskin in case you start having friction on your feet, and this is good for padding. You should definitely keep a section of moleskin in your bag. Now here's a fun item, and you had a small area that you needed to suture. These are some ready-made stitches, and basically how you would use them is you would take them out of the pack and you would peel off the back and put them onto where you're suturing, and then you would twist these little parts right here to close the suture. So and then you would twist these little parts to close your open wound. Again, this is for a small area. If you want to go the lighter and needle way, that's fine, but this would leave, this would be painless for the patient, the person that got injured, because you're just literally doing it topical and it's for a smaller area, and you can cut it down and separate these stitches. I don't want to say stitches, it would be like, I don't know, wound closure device. There you go. When it comes to closing an open wound that is too large, where it definitely needs to get closed, you can do something like this. You can also do the old needle and thread way, and God help you, I hope you know what you're doing and you know about the different layers of skin and know how to do that correctly. There's a technique to it, so make sure you know it. And you can buy practice kits to learn to suture. I think the most practical way that most preppers go is to have a staple gun, to have like a stitching staple gun. I don't know exactly what they're called, but basically you would take the staples, and wherever the wound is, you would just staple it shut. It's actually known to cause less infections than doing stitches. But in this case, that would be too heavy to bring with us, because we are trying to pack light in case we have to go on a vacation or in case we have to bug out. This could be either or, this kit. So I like to keep something like this that's lightweight and easy to carry. And I also keep the instructions with me. Keep some bandage dressings in different sizes, and I have a small roll of gauze with some tape, medical tape, and I also keep some cotton applique. Important things you want to have in your first aid kit is these blister heal bandages, because God, when you get a blister, that could really like just put a dent in your trip. It could put a dent in your bugging out, because you're going to be bending down like every second. You're going to be slowed down. You want to just be able to slap one of these on, change your socks, and keep moving if you're bugging out, or even if you're on a trip. Also in the same bag, I keep these folding scissors and a safety pin, because this could be helpful with a bigger piece of gauze or trying to keep something together if you're injured. I also have these scissors that I could use to cut gauze with. In this bag, I keep face masks and gloves, because one of these are basically my barriers. This is something I learned in first aid. You never want to not have barriers if you're gonna help another person out. So basically, you would ask if the person is sick. You would say, "Hi, I am a first aid emergency responder. Would you like my assistance?" And if they are conscious, then they would say yes. And you can assist them by start putting on your barriers. Now, if the person said no, you legally cannot help them. Even if they are bleeding to death, you cannot touch them. So that's something I learned in first aid. Now, if the person is unconscious, you would assume consent to help them. So you would then proceed to put on your surgical mask and get your gloves. And if the person needed CPR, I have this basic barrier here that I like to carry. So you would put this part over the person's face, and then you would proceed to give them CPR. This is one-time use only. You know, they do make bigger CPR kits, but again, we are talking about practical and ready to go kits. So this is just, you know, I just have the one in here. But yeah, you definitely want to have something to be able to give somebody CPR, and you definitely need to get trained in learning CPR while times are good. We would want to have the skills to save them and not just panic and stand there not being unable to help. You want to know what you would be able to do. A lot of people end up freezing when it comes to moments of rescue, because they do not know what to do. They lack the education, they lack the skills, they lack situational experience. If you never were in a situation where you had to save somebody previously, like, would it be natural to you to jump in and save them? So that's something you have to think about. And if it's not something that comes to a second nature to jump in and help a person, then you need to take some classes and have some education and experience. But I will say this, even with education and experience, you can still freeze in the moment. So the next important thing would be to do is to go get help. If you cannot help. Viscous cleanse. So this would be great if you ended up in a situation where somebody was badly wounded and you needed to make sure that you had clean hands, but would want to use hibiscus cleanse because it would disinfect your hands much stronger than some kind of hand sanitizer. So this skin cleanser helps reduce bacteria, and it could also help with the area that is dirty around a wound as well. That's what you would use this for. Potassium iodine drops, and the reason why I have it in a drop form, not a pill form, is because in case there was other people that needed this, I can just add 2 drops. I think it's 2 drops to their water, and yeah, it's 2 drops. So, and they would get potassium iodine. This is in the event that there was some sort of an evacuation and there was a nuclear threat. You could use this to protect your thyroid. The likelihood that I would ever use this, I don't know, but I'd like to have it. And with the pills, you have to take 1 for each day of exposure for up to 14 days. So that would just be more, I think, to carry. This is a little bit simpler for me and my family, that we could just use this one rather than carrying like all these large bottles if we had to bug out. Also want to have a chest seal. You definitely want to have at least 2 pieces in case it's a gunshot wound, to cover the entry wound and the exit wound. So this is definitely necessary to have in your bug out kit. So everything I just showed you fits comfortably into this bag, and this bag is, just to show you guys, it is about like 8 inches like wide, 9 inches, there you go. So this is not like some super big bag. Like if you're traveling, you can easily replace an extra pair of shoes for a very handy, very thorough homemade first aid kit. I also do have other items I want to show you guys that I keep in my bug out bag that do not fit in this kit, that I think are essential as well for a bug out bag. So this would be just if you're traveling. In my bug out bag, I also keep this splint. Now, some people might not find this necessary because you can make a an arm sling with a shemagh, and if a person broke their arm, likewise, you can make a splint using a tree branch. So you don't actually super badly need this, but it's just more practical for someone who's not out in the field making constant splints. Like for someone like me that doesn't have a whole lot of experience making splints out of tree branches, I would prefer to use this if I had the option. The item that I have here is a compression bandage, and this would be for severe wound trauma. It's also known as an Israeli bandage. So I think that this is a very necessary item to keep in a bug out bag. It's a must-have item in case somebody was badly wounded. You definitely want to have a tourniquet, and you need to know how to use this thing. You cannot keep it the same way that it arrives. It needs to be ready to be deployed. And I'm going to be going over this in this video. There will be another video about it at a later time, but you do want to have a tourniquet, and it cannot stay positioned in the way that you bought it in. The last thing I keep in my bug out kit is the snake bite and insect kit, and I have not used it for snakes, but it is great if you get a mosquito bite or some other little bug bite. It comes with a full-on kit in here that you can like suction the stuff out of your skin, and then it makes it not itch anymore, and it's pretty awesome. I've used it a few times and the itching will stop. But you know, like I said, this is just an additional item. It may or may not be necessary. Here in New York City, there are no native species of snakes in Central Park, and the only places you might find snakes is in abandoned lots. If you want to find snakes in New York, you have to go up to the Adirondacks or to the Catskills. Like, it's not typical in New York City to see a snake or come across a snake. There are snakes. The likelihood you will come across one is really unlikely unless you're going somewhere that is abandoned. I still like to have this thing because it's awesome for mosquito bites. One thing this kit doesn't come with is a Sharpie, so you want to keep a small Sharpie in your bag in case you do live in an area with lots of snakes. The Sharpie is beneficial for when the bite took place. You would outline where the bite is swollen and hurting up to, and then you would write what time it is, and then you keep checking your clock, and then every 30 minutes you would keep circling the progression of that until you were able to get professional help and some sort of anti-venom. That way the medical person that's treating you knows how far the situation has progressed. So that is all I have for you guys today, and I hope you enjoyed this video. I hope you learned that having a first aid kit that is compact and waterproof and weighs the size of one pair of your shoes in your travel bag or in your bug out bag is well worth its weight. And I will see you next time on the next video. Bye bye. This is an afterthought I had after I got done filming, and I'm going to be adding this into the video. So the primary reason why I made this video is because a lot of the waterproof first aid kits you will see on the market are huge and bulky, and a lot of the things that they have inside the kits are things that, you know, are not really reusable, sustainable. They're not really items that would help be as comprehensive as the kit I showed you. When it really comes down to it, you can buy a first aid kit that's already made, but once you get into prepping, once you actually go out and start using your kit, you're going to see that things are missing. And this is why I made this video, is because you can make your own first aid kit and just build on it over time and make it so much more compact than the bulky cases that you're going to be buying and probably storing in a closet, or not being able to fit in your bag, or not being able to take with you. You know, for the weight of a pair of shoes in your suitcase or in your book bag, you can make the kit that I'm showing you in this video. So that is the goal of this video.